Mr. Doggett, you're recognized.
Thank you very much, Mr. Chairman. While the MA ads that are direct to consumer to seek new enrollees are usually misleading, the Medicare Advantage ads that are resisting reform are truly deceptive. A good example are those that are being run now, over $1 million worth in the state of Louisiana, against its senator, Republican Senator Dr. Cassidy, claiming that his efforts to end upcoding represent deep Medicare cuts for the people of Louisiana that will deny access to their doctors. Dr. Fiedler, can you explain why reining in waste, fraud, and abuse in Medicare Advantage can actually benefit all enrollees, including even those that are in MA plans, without in any way jeopardizing access to their health care, as these false ads have been claiming against Senator Cassidy?
As you mentioned, we're currently paying Medicare Advantage plans tens of billions of dollars more per year than it would cost to serve the same beneficiaries in traditional Medicare. And so if policymakers were to rationalize the MA payment system and use those funds to invest in the base Medicare benefit, that approach would obviously benefit traditional Medicare enrollees, but reinvesting the savings in those ways could benefit Medicare Advantage enrollees as well, because MA plans are required to cover the base Medicare benefit, because traditional Medicare is the competition for MA plans, and because those higher benefits would translate into higher benchmarks for MA plans. And because the MA plan is so inefficient, the MA status quo is so inefficient, depending on the circumstances and the design of that type of policy, even MA enrollees could end up better off on that than they are under the status quo.
Well, thank you very much, and I'm sorry to say I hear the same kind of false ads are being run against Chairman Schweikert out in Arizona that have been used in Louisiana and elsewhere, when we could be working together to try to get the taxpayers more for their investment. Let me ask you to turn to the whole issue of risk adjustment, because after being promoted as a way to save taxpayer money and improve quality, we're still waiting to get the first cost benefits from Medicare Advantage, and in fact has spent billions more than traditional Medicare. I have repeatedly urged CMS to rein in the abuse of upgrading, the very one that they're running these ads against people who raise that question. What are the benefits of adopting some new risk adjustment formula, such as I believe it's called DESI, that has been recommended by MedPAC? How would it impact good actors that don't engage in upcoding?
So I think the evidence is quite clear that CMS's existing methods for adjusting for higher coding intensity in Medicare Advantage are seriously inadequate, and that's a big reason why payments to MA plans have ended up so much higher than intended. If CMS were to adopt a better method for adjusting for coding intensity, and I think MedPAC's and the research community's DESI method could be the foundation of a method for doing so, that would help mitigate this type of problem. I think that method could be used in one of two ways. It could be used to calculate insurer-specific adjustments, or it could be used to calculate adjustments at the market level. I think the advantage of insurer-specific adjustments is that it would only adjust coding intensity to the extent that a particular insurer plan is engaged in more intensive coding activity. I think a caveat with an insurer-specific approach is it could expand the scope for plans to engage in favorable selection. So I think there are trade-offs with these types of approaches.
Finally, I'd ask you to turn to supplemental benefits. You know, when the enrollment period begins and we start seeing one ad after another on television, you get the impression you get free rent, free visits, free groceries, perhaps even a free autographed football from Joe Namath. But in fact, there are some limits on supplemental benefits, and I wonder if you could tell us a little more about just expand on your testimony concerning whether Medicare Advantage plans are adding significant value through these supplemental benefits, a number of which, when they relate, for example, to dental service, are the very type that some of us have been trying to get added to traditional Medicare.
So I think the reality is when we're talking about particularly dental services, the coverage that MA plans are actually offering is often much more limited than what people expect to be covered under a dental plan in terms of either what services are covered or what the financial limits on the coverage are. There are MA plans do offer additional cost-sharing protections, and in some cases lower premiums. But I think the issue from my perspective is those additional benefits aren't commensurate with the additional money we are paying those plans. And so there are probably much better ways to deliver those additional benefits to Medicare beneficiaries than the sort of bank shot through higher MA payments that we're working with today.
Thank you, Mr. Chairman.
Thank you. I now